sometimes I catch myself in the mirror and I'm just like, Jessica, we gotta do better.
YouTuber Jessica Pway has died. She was 36 years old. According to E! News, the beauty influencer's sister confirmed her death on Instagram. The mournful tribute revealing Jessica died last week, nearly a year after she first shared her devastating diagnosis, stage 3 cervical cancer. The tragic announcement also an explanation for her fans after her prolonged absence on social media.
I hope that you grab whatever you could from this video. I hope you grabbed some tips.
That's Jessica a decade ago in one of her earliest YouTube posts. Her channel kept on growing as she shared beauty secrets and her life at home.
As you guys can see, I am rocking a new do. These are crochet braids. So in this video, I'm gonna just tell you guys a little bit about my experience with them.
By 2024, Jessica had over 200,000 followers, plus a massive fan base on the gram. And it's where she revealed heartbreaking details from her cancer journey. Jessica claiming her initial symptoms were misdiagnosed, which made her condition worse as her cancer went untreated.
She's bouncy, she's voluminous, she's feathered, she's all that goodness.
She said of her health battle, "I hope that at least one person is encouraged by my story." Jessica's survived by her husband and 2 children.
The unexpected death of beauty influencer Jessica Pway has many concerned after she shared she was misdiagnosed with fibroids, only to learn later she actually had cervical cancer.
Dr. Wendy McDonald is here with more on what women need to look for and what questions we should be asking when we have our annual exams. Thanks so much for coming in.
Thank you for having me.
Because we were just talking in the break. There's a million things because she went to a doctor when her symptoms were present.
Yes. This
So
is
what
such a
happened?
tragic story,
Yeah.
right? It's so tragic because it's so preventable. She was found unresponsive on her bathroom floor because she was bleeding excessively. And she tells a story on her social media, God rest her soul. It was June of 2022. She had to be blood transfused and she was told, oh, you have fibroids, this is normal. And she actually even required a couple of more transfusions in the coming months.
I think she did a total of 3
Yes,
hospital stays.
Yes,
Okay.
yes. So then the bleeding gets better, and then her pain starts to increase again, and then the bleeding comes back in December of 22. So she's admitted to the hospital because she's so weak that she can't, kind of function. And only in January of 2023 was a doctor kind of, thoughtful enough to say, let me do an exam.
Yeah.
When they saw a mass that obscured her whole cervix, she then goes to oncology and is diagnosed with cervical cancer. But this is a 8-month span between the beginning of this bleeding where she's told, oh, it's fibroids, it's normal, and then you're diagnosed with cervical cancer.
And then 9 months later, she's dead.
That's just so tragic.
So in this case, was she just told she had fibroids? They didn't do an ultrasound? They didn't do an exam?
Now, I don't know. I'm not,
Okay.
I wasn't involved in her care, obviously, right? But I can only imagine that they did do imaging and saw a mass and said it was fibroids. I can only imagine that because
Okay.
a mass can be a fibroid. Bleeding can be coming from fibroids.
Okay.
But the take home here is that cervical cancer is detectable in like 99% of cases if you're getting a Pap test.
Okay.
99. Literally, a Pap will rule out cervical cancer in over 99% of cases.
Crazy.
What can you do as a patient? I know sometimes when I walk into the doctor's office, I automatically have this feeling the doctor knows what's best. The doctor has
Right.
been trained.
Right.
If the
100%.
doctor says this, then this is what it must be.
Right.
How can I advocate for myself, pushing that doctor to go further?
If ever you feel, first of all, I think our gut our gut means a lot, right? If you feel like this doesn't make me feel comfortable, I'm uneasy, getting a second opinion is reasonable. But I also think giving the doctor the desire to, or telling the doctor that your desire is to prove that you're safe.
Yeah.
Prove that I'm safe.
Right.
Show me the data. Where is my Pap? Like, what is the result? If I have fibroids and you say, oh, that's normal, well, let's follow them and make sure they're not growing excessively because fibroids can be cancerous too. Now, very, very rarely, less than 0.1% of fibroids are cancer.
Okay.
Most fibroids are benign and most people will get fibroids. This is actually a sign or an image of fibroids. They can be in various locations and they can look, very large. They can even look kind of ominous, but you want to make sure that you're following them to make sure that they're not, growing excessively, you're not bleeding excessively. But cancer of the cervix is going to look like a mass at the level of the cervix. And I'm certain it was probably growing in this situation.
Yeah.
It was bleeding, and all it needed was a pap, a swab. Ultimately, she had a biopsy of the mass that determined that it was cervical cancer.
And she found out at that visit.
Yes.
It was determined at that visit. It wasn't like she had to go home and wait.
The person looked, and she said in her account, she says, finally the doctor said, "Can I just take a look?" And I'm saying, I'm reading this, and I'm like,
why weren't you looking before, right?
Oh my God.
Well, okay, so one thing is, I know a lot of guidelines say, oh, only get a pap every 2 years.
Right.
Yes.
Only get a pap every 3 years. I don't feel comfortable with that. Can I go to my doctor and say, I need one every year?
Yes.
Every time I come to see you for my annual, I need a pap.
Yes, now let's back up. The cervical cancer screening guidelines changed some years ago from having yearly PAPs. First they went to every 2 years, and now they're saying we can do PAPs every 3 to 5 years with HPV co-testing.
Okay.
That is because cervical cancer and precancer moves really slowly. I mean, it's like the snail of cancers,
Okay.
right? Like it does not go from 0 to 60. It goes from 0 to 1 to 2, right?
Right.
So the idea is that if you have a longer span in between screening, you're going to catch it even if it is 3 years later. You're going to catch it well before it's cervical cancer. But these are guidelines.
Right.
Guidelines means really advice.
Yes.
Like you can take this advice, or you can say, you know what, I want a PAP every year, and your insurance will likely
Absolutely,
cover
yes.
that PAP every single year. So I have patients, especially when the guidelines changed, I was like, you don't need a PAP, and some people push back. And then I'm like, why am I pushing back to these
Right.
people? If you want a PAP and you understand the reasons, I'm gonna do the PAP.
Right. And then going back to fibroids, if there's so many women that have them,
Yes.
why don't, if they cause bleeding and they cause potential issues, why don't they always take them out?
So if they're causing issues, often we can take them out or we can treat them in various ways. But if they're not causing issues, it's kind of irresponsible, honestly, to like do surgery on everybody who has fibroids, because then you'd be doing surgery on everybody.
But in this case where she was told she's bleeding that badly, it was fibroids, why wouldn't they opt for surgery if that was even just the fibroids?
It's a great question, my friend. It's a great question. I mean, as a gynecologist reading this, I'm like incensed by this whole
Yes.
situation, because there's so many reasons and so many ways that this should have not
Been
happened
caught,
this
yeah.
way.
And you say you yourself got calls from a lot of people when the
Yes.
story came
They were
out.
like, please help me understand, because you read this and you hear misdiagnosis fibroids, and all these people have fibroids, myself included.
Yeah, you're
And you're like,
scared.
do I have cervical cancer? If you've had a PAP and you're up to date on that, you don't have cervical cancer. Like, you don't. But we can still evaluate and make sure a person is safe and their bleeding is, reasonable, and we're reducing symptoms. But the PAP saves. And I have to
PAP's where
plug.
it's at.
And I have to plug the HPV vaccine. There was just a study that came out that showed that out of I think it was thousands. It was like 40,000 people who got HPV vaccine before the age of 14. It eliminated cervical cancer in that population.
goodness.
Eliminated it. None, not zero, not one case of cervical
You
cancer.
guys, let's get right into this. This is ridiculous. You have watched this and you heard about her, Jessica, just only 36 years old, and she passed from cervical cancer, like stage 3. Like, if you just listen to that whole story, which I hope that you did, this is ridiculous. Beautiful girl, vibrant girl, married, 2 beautiful kids, and she's resting in peace. And so I just wanted to put something on my channel. When I saw that, I'm like, oh my God, that's ridiculous, because the pap smear is what everyone needs to get. If you're a female, you need to be getting a pap smear. And I'm going to put a lot of information down below, you guys, like I always do. But I wanted to come on here because when I heard about her story, and she's such a beautiful girl, just so young and vibrant. She had a YouTube channel. She was doing good on the channel. Like I said, beautiful girl, mother of 2, married. And then, all of a sudden, cervical cancer, when she was actually going, having all the symptoms, and she was actually going to the doctor on a regular basis, and she had to get several blood transfusions because she was losing so much blood, and they was just saying it was fibroids. And then you guys know, if you get, whether you know or not, but I'm trying to tell you, if you get a pap smear, which usually people get those every year, then they can see if you have any kind of cancerous cells. They will pick them up in the pap smear. When you get the pap smear, they will find out. So that's the purpose of getting the pap smear. Now, cancer is not a respect of persons. Unfortunately, I know several different kind of cancers, male and female. My dad, he actually passed of prostate cancer, and thank God he lived to be 92. But I was also a volunteer for the American Cancer Society at one point in my life. But I do know several people who have passed, unfortunately, of different type of cancers. One of my friends, she passed of breast cancer. May she rest in peace. But you guys, it's a simple test called the Pap test, Pap smear, that you can go and get once a year. I'm going to drop a lot of information down below for you, as I always do. And I just wanted to bring this story to you because cancer is not a respect of persons. It don't matter how old you are, you know, what your age is. So you want to make sure that you do your due diligence. And you guys know on my channel, I'm always trying to do things that'll help you. Even if it seems like it's a topic that don't even belong on my channel, it really does not matter to me. As long as I'm doing something that's helping and that's beneficial to you. So when I saw this, I'm like, okay, I used to be a volunteer for the American Cancer Society. And I know, unfortunately, several people that pass of cancer. And so you guys, please get a Pap smear. You see this young, beautiful girl, African American. And so you got to insist, you know, like, I don't know why the doctors were not, you know, trying to do a Pap smear on her, because that's a really simple, like 5-minute test that they can do. And then they could have found out right away. And then by the time someone did, a doctor did decide to do a Pap smear, you know, I mean, it was so much blockage there from the size of the cancerous tumor. So you guys, please do your due diligence. Get your Pap smears, I think every year. Again, I'm going to drop information down below on the guidelines and the recommendations. And you guys, I just want to come on here and make this brief video. Just saying, you know, please get your Pap smears and please do your due diligence. Get your mammograms and all the other stuff that we do get. So thank you guys so much for watching. Please look at the links down below. I hope you subscribe, and I'm going to see you guys on my next video. Peace and blessings.